Meanwhile, the Ebola outbreak in the Democratic Republic of Congo and Uganda has raised concerns across the East African region, with Kenya now heightening surveillance and preparedness measures at its border points. The Ministry of Health maintains that Kenya is adequately prepared and has set up enough screening and isolation centers, as well as enough human resource trained on handling Ebola. Here's NTV's Helen Aura with what we know so far.
According to the World Health Organization, the latest outbreak caused by the rare Bundibugyo strain of Ebola has so far seen over 600 suspected cases recorded in the DRC and over 130 suspected deaths, with dozens of cases already confirmed. Uganda has also confirmed at least 2 Ebola cases linked to travelers from the DRC. The outbreak has prompted the World Health Organization to declare the situation a public health emergency.
Currently, Ebola is a regional risk. It's not a pandemic. It's a focal epidemic, particularly in Eastern DRC. But it's a regional risk and concern. That's why it's been declared public health emergency. A public health emergency of concern, of international concern, is because of the movement. You know, people moving from DRC to Uganda, Rwanda, Kenya, the high mobility, and because of the high infectivity rate, it means it can easily spread.
Kenya has an established isolation and treatment capacity for viral hemorrhagic fever management, including Ebola. And there is a national viral hemorrhagic fever treatment unit at Kenyatta National Hospital, which is operational and is available for management and confirmed cases. In addition, the counties and points of entry have also identified holding areas and isolation spaces for temperature management and assessment of suspected cases before referral.
Public health experts say Kenya's preparedness will largely depend on early detection.
The lab that's supposed to conduct this test has to be at the highest biosafety level, which is biosafety level 4. Because most labs are at biosafety 1 or 2, which means you can go into the lab, they have, like the environment, they have the hoods, that will be biosafety 2. Like in our lab, we are biosafety 3 because we have special hoods where you can handle TB, for example, and it will not infect you, and the technologies, they know how to. But biosafety level 4, you actually require a much deeper level of, or higher level of security. The labs that actually handle Ebola is Kemri Nairobi, Kemri Kisumu, and National Public Health Lab.
The Ministry of Health has also intensified issues of traveler screening at all points of entry. And this one I want to emphasize for the officers who are manning the ports of entry. Nobody should enter into the country without being screened.
Ebola is a severe viral disease spread through direct contact with bodily fluids of infected persons or contaminated surfaces. Symptoms include fever, vomiting, diarrhea, fatigue, and, in severe cases, internal bleeding. Health experts, however, maintain that there is currently no confirmed Ebola case in Kenya, but emphasize that preparedness remains critical due to increased regional movement and cross-border trade. Helen Aura, NTV.